Derbyshire Healthcare Branch. I'm also a member of Unison's Health Service Group Executive, and I'd like to bring the support and solidarity of my branch for this demonstration and all the campaigning you are all doing to save your A&E department. Just as I sent my solidarity to the Glenfield demonstration also today, where they're campaigning to save the very important heart unit, children's heart unit, which is threatened with closure by NHS England. I'd also like to point out that somewhere over there there's a banner of Unison East Midlands Ambulance Service, and their attendance here is because they, along with everyone else, know that time means lives, that the closure of an A&E department is not just a financial question, it's about the life of the local population, and that ambulance service branch understands and is involved and supports the campaigns as much as anyone else. And they also know, like everyone else here, that what the pressures are at Lincoln County, because you can't take an A&E away and then suddenly assume everything is going to be hunky-dory at the other places. It's an absolute scandal in a county like Lincolnshire with poor, to be honest, poor is probably an underestimate, poor public transport and poor road network, that they can think having an A&E department 25 or so miles away is sufficient or satisfactory. So the demand is clear. Reopen Grantham A&E 24/7 and make sure and prevent any feared closure or downgrading by the sustainability and transformation plans which are due to be published towards the end of the year. Now, every day we read of a crisis at one hospital or another, and that crisis hasn't just happened. It happens because of the failure of funding in the NHS. Around the country there are campaigns everywhere to defend services. Only last Saturday there was a protest in Wickham about the closure of their A&E and the running down of maternity services. We have the Hands Off Huddersfield Royal Infirmary campaign, despite the CCG decision only recently, continues the fight. Chorley, the A&E closed. Fairfield in Bury, under 18s are not to be brought into that A&E department. County of Stafford Hospital, the same again. And this is all flowing from the 5-year forward plans of Simon Stevens at NHS England. Because fundamentally, that plan, supported by the government obviously, which feeds through into things like the Carter Review on Efficiency, feeds through to the STPs and the Lincolnshire version, Lincolnshire Health and Care Plan, is about cutting, or saving in their terms, £22 billion from the NHS by 2020. It is shameful. It is shameful. My view is clear. The money is there. Because in Lincolnshire, what they're talking about is saving £300 million from the health and social care budget by 2020. But the money is there. Private Finance Initiative, many people may have heard of that, often known as PFI. There are 105 current PFI projects in the NHS in England at the moment. They supported a building programme of just under £12 billion. The actual amount that we, the taxpayer, will pay back to those private companies like Skanska at Sherwood Forest Hospitals, the total amount for that 11 to 12 billion pound will be 66 billion pound. Last year alone, the spend to those companies was just under 2 billion, and this year will break 2 billion pound. So the money is there, but the money is being taken out of the NHS, out of our pockets, and given to the big companies. And with the pharmaceutical companies and the privatisation of things like Virgin and Serco, Carillion, then we can see where much of our health service spend is going when it shouldn't be. So my position is clear. I oppose all attacks on our NHS services. I oppose all attacks on staff jobs and terms and conditions. I support the junior doctors, as my union does, because we know they are fighting for the NHS, and after them they will come for my members on social hours as well. And the cheaper my members are, then of course we'll have a higher turnover, but also it's easier to privatise. They're attacking our redundancy pay because, again, it's cheaper to get rid of people and then cheaper to privatise. I oppose the merger and takeover of one hospital by another or one trust by another when the aim is to actually use it to cut costs. So it's hardly surprising that around the country campaigns are coming together, like in Huddersfield and elsewhere, coming together in health campaigns together, and they have decided to call a national demonstration in March, likely to be the 4th of March, on the slogan, "It's our NHS, stop the cuts, one fight, we all unite." I will be campaigning to support that demonstration. I'm sure many people here will be on that demonstration. Many people here have already been down to London. I will be campaigning for my union, Unison, to support this demonstration. I shall also be campaigning for my union to support unified industrial action to take the NHS. The government has a small majority. The CCG can be put under pressure. Work is being done with the scrutiny committee. The trusts are being put under pressure. The NHS is our most loved institution in Britain. We can win. Thank you.